It often begins with confusion. A woman feels pain in her lower abdomen, a strange heaviness in her bladder, a burning pressure when she tries to pass urine. She feels as if something is wrong. She tells herself it must be a urinary infection. She drinks more water, she takes home remedies, she searches symptoms on the internet, and finally, she goes for a urine test. But the surprise begins here. The test comes back normal. No infection, no bacteria, nothing that explains the discomfort. The pain continues, the urgency continues, the frustration grows, and suddenly she enters a medical mystery that thousands of women face quietly every day. Pain without infection, symptoms without explanation. And this is where the real suspense begins. I'm Dr. Ayurmoolam, and today we are going deep into a hidden world of female urinary problems that look like urinary tract infections, but are not infections at all. These conditions confuse patients, confuse families, and even confuse doctors sometimes, because they hide behind normal reports. This matters because women are often told, it's nothing, or it's just stress, or drink more water, while the root cause silently worsens. Many women suffer for months or years before finding the truth. And the truth, like any suspense story, is far more layered than it appears. The bladder is a sensitive organ. It reacts to irritation, inflammation, hormones, stress, pelvic muscles, even diet. Pain in the bladder without infection is not imagination. It is a signal. And today, we follow that signal to uncover what lies beneath. Imagine a woman sitting in a clinic, frustration visible in her eyes. She says she feels pain every time her bladder becomes even slightly full. She urinates again and again, sometimes 10 times, sometimes 15 times a day. She wakes up multiple times at night. Sometimes she feels burning, even when the urine test shows nothing. She wonders if something is wrong with her mind. She wonders why no one understands this pain that has no name. The doctor observes the tension in her shoulders, the anxiety in her voice, the way she sits carefully as if pressure on her lower pelvis will increase discomfort. This is not typical infection pain. This is something deeper. Women with hidden urinary conditions report patterns that seem unusual. Some say the pain worsens during periods. Some say certain foods, coffee, spicy food, acidic fruits, trigger discomfort. Some say intimacy increases bladder pain. Some say they feel a constant awareness of their bladder as if it's never fully empty. Some feel pelvic pressure. Some feel sharp stings. Some feel burning without infection. These symptoms confuse them because they don't match the typical UTI symptoms they've heard about. Doctors observe that these women are often emotionally drained because no test validates their pain. But medically, the bladder can be inflamed even without bacteria. The nerves around the bladder can become hypersensitive. The muscles in the pelvic floor can become tight and trigger pain that feels exactly like infection. And sometimes the root cause is far away from the bladder, but still influences it. To understand these hidden conditions, let's explore the science. One of the most common conditions is interstitial cystitis, often called bladder pain syndrome. In this condition, the bladder lining becomes irritated, sensitive, or even chemically inflamed without any infection. Imagine the bladder as a protective balloon. Its inner layer normally shields the bladder wall from acids and chemicals in urine. But when this protective layer becomes weak, urine irritates the nerves inside the bladder. This causes pain, burning, urgency, and a feeling of pressure. But urine tests remain completely normal. No bacteria are involved. Another hidden condition is pelvic floor dysfunction. The pelvic floor muscles support the bladder, uterus, and bowel. When these muscles become too tight or too weak, they can compress nerves that connect to the bladder. This causes constant discomfort and a sensation of needing to urinate again and again. This is why some women feel bladder pain during stress, because stress tightens muscles unconsciously. Ayurveda explains this as vata imbalance, where tension accumulates in the lower pelvis and disturbs the natural flow of urine. Endometriosis is another silent culprit. When uterine tissue grows outside the uterus, it can attach to the bladder, pelvic walls, or surrounding nerves. Women with endometriosis often feel bladder-like pain, especially during periods, but their urine test remains normal. The pain is real, but the cause lies beneath layers of tissue, invisible to basic tests. Hormonal imbalance can also irritate the bladder. Estrogen supports the lining of the urinary tract. When estrogen levels drop during perimenopause, postpartum, stress, or hormonal imbalance, the bladder becomes more sensitive. Women may feel dryness, burning, or pain without infection. Ayurveda describes this as depletion in tattoos that weakens the urinary channels. There is also a lesser-known condition called urethral syndrome. The urethra becomes inflamed or irritated even though no bacteria are present. Women feel as if they have a UTI, but reports show nothing. This irritation may come from soaps, sexual friction, dehydration, or even allergic reactions. And then there's the emotional layer. The bladder is deeply connected to the nervous system. Anxiety increases adrenaline. Adrenaline tightens pelvic muscles. Tight muscles compress bladder nerves. This is why women under emotional stress often feel urinary urgency, frequency, or discomfort. The bladder becomes the messenger of emotional overload. Let's move toward diagnosis. When a woman comes with bladder pain but normal urine tests, the goal is not to dismiss her complaints, but to investigate deeper. First is a detailed history. What triggers the pain? When did it start? Does it increase during periods? Does it worsen with certain foods? Does stress influence it? Physical examination helps detect pelvic tenderness or muscle tightness. Ultrasound checks for bladder wall thickness, ovarian cysts, or unusual growths. For interstitial cystitis, cystoscopy may be done, where a camera checks inside the bladder. Hormonal blood tests may be required. In suspected endometriosis, pelvic ultrasound or MRI is useful. If pelvic floor dysfunction is suspected, pelvic physiotherapy assessment is needed. Ayurveda diagnosis includes evaluating digestive strength, dosha imbalance, emotional patterns, and lifestyle factors that disturb the urinary channels. Women should consult a doctor when the pain persists for more than a week without infection, when symptoms keep returning, when bladder urgency disrupts sleep, when intimacy causes pain, when periods worsen symptoms, or when emotional stress seems connected to urinary discomfort. Early diagnosis prevents years of suffering. Now let's turn towards solutions. Diet plays a huge role in bladder health. Certain foods irritate the bladder, even when infection is absent. These include caffeine, tea, spicy food, citrus fruits, tomatoes, carbonated drinks, and artificial sweeteners. Avoiding these for a few weeks can bring dramatic relief. A soothing bladder diet includes warm water, coconut water, oats, rice, bananas, pomegranates, ghee, cooked vegetables, fennel seeds, cumin, coriander, and turmeric. Ayurveda recommends reducing acidity and supporting digestion because undigested food creates toxins that irritate the bladder. Drinking warm water throughout the day calms vata imbalance. Cranberry is helpful for preventing bacterial infections, but does not help much in non-infectious bladder pain. Aloe vera juice can soothe inflammation. Magnesium-rich foods relax the muscles around the bladder. Exercise is essential, but must be gentle. Walking improves blood circulation. Yoga poses like child's pose, butterfly pose, and pelvic tilts release tension from the pelvis. Deep breathing reduces nerve irritation. Stress relief exercises reduce adrenaline spikes. Pelvic floor relaxation exercises are more important than strengthening exercises because many women with bladder pain have overactive pelvic muscles, not weak ones. Stretching the hips, lower back, and thighs reduces referred pain. Ayurveda suggests daily oil massage around the lower abdomen to calm the nerves. Medicines and supplements depend on the cause. For interstitial cystitis, certain medications reduce bladder irritation and nerve sensitivity. For pelvic muscle tension, muscle relaxants may be used. For hormonal imbalance, estrogen creams may help postmenopausal women. For inflammation, anti-inflammatory medicines may be used temporarily. Ayurvedic herbs like Gokshura, Punarnava, Varuna, and Chandraprabhavati support urinary health. Brahmi and Jatamansi help reduce stress-induced bladder irritation. Ashwagandha balances the nervous system. Supplements like magnesium, D-mannose, and L-arginine help improve bladder function. Lifestyle and Ayurveda tips bring long-term relief. Avoid holding urine for long periods. Avoid chemical-based intimate washes that disturb natural pH. Wear loose cotton clothing. Take warm baths to relax pelvic muscles. Reduce screen time at night to balance hormones. Manage stress through mindfulness. Practice slow breathing before sleeping. Avoid cold drinks, as cold aggravates vata and triggers pelvic tension. Use heater pads on the lower abdomen during flare-ups. Drink cumin, coriander, fennel water daily for urinary channel cleansing. Keep bowel movements regular because constipation puts pressure on the bladder. Avoid overthinking and overstimulation, as mental strain directly affects the pelvic nerves. Let's make this simpler with a do and don't list. Do drink warm water. Do follow a bladder-friendly diet. Do relax pelvic muscles. Do seek emotional support. Do track your symptoms. Don't self-diagnose. Don't take antibiotics repeatedly when reports are normal. Don't consume bladder irritants. Don't ignore stress. Don't push through pain during intimacy. Prevention and long-term care are simple but powerful. Begin the day with warm water. Avoid caffeinated drinks on an empty stomach. Eat freshly cooked food. Sleep on time. Keep stress under control with brief relaxation rituals. Strengthen emotional health. Maintain hygiene without harsh products. Create a rhythm of hydration through the day. Build a weekly routine that includes gentle yoga and daily stretches. Respect your bladder signals. Balance digestion. Reduce acidity. Follow Ayurveda's principle of warm, calm, steady habits. Over time, the bladder becomes stronger, calmer, and less sensitive. Now imagine the woman from our earlier story. After months of suffering, she finally discovers the real cause of her bladder pain. Not infection, but inflammation. Not bacteria, but muscle tension. Not disease, but hormonal imbalance combined with stress. As she receives proper guidance, her nights stop being restless, her days stop being anxious, her bladder stops controlling her life. The mystery dissolves, the suspense finally ends, and she returns to living freely again. Female urinary pain without infection is not imaginary. It is not rare. It is not normal. It is a real signal from the body asking for understanding and care. When you decode that signal, you change your life, and you begin healing from the inside out. If this explanation helped you, make sure to like the video, share it with someone who may need it, and subscribe to Dr. Ayurmoolam for more clear, practical, and life-changing medical insights.